Endocrine, nutritional, and metabolic diseases. So, in this chapter, we will be seeing the ICD codes for the endocrine, nutritional, and metabolic diseases. So, the different diseases which afflicts the endocrine systems, the endocrine glands, for example, pineal gland, thymus gland, adrenal gland, ovaries, testicles, pancreas, thyroid gland, hypothalamus, and pituitary gland. So, this system is quite important for the normal and regular function of the body. So, these are the chapter specific category code blocks. The code range is E00 to E89. E00 to E07 is disorders of the thyroid gland. E08 to E13 category, you have the codes related to diabetes mellitus. E15 to E16 category, you have other disorders of the glucose regulation and pancreatic internal section. E20 to E35, disorders of other endocrine glands. E36 to E46 is malnutrition. E50 to E64, other nutritional deficiencies. E65 to E68, overweight, obesity, and other hyperalimentation. E70 to E88, metabolic disorders. E89, post procedural endocrine and metabolic complications and disorders not elsewhere classified. So, these are the chapter specific category code blocks. So, if you want to check a disorder of the thyroid gland, you can directly go to the code range, that is the category E00 to E07. You will find the ICD code easily. So, diseases of the endocrine system are classified along with the metabolic and nutritional conditions. These conditions include thyroid disorders, diabetes mellitus, malnutrition, overweight, obesity, metabolic disorders, pancreatic internal secretions, and post procedural complications. You can check the codes for marasmus. So, as you can see in the picture, the code category is E41 and kwashiorkor, that is E40. Again, that is also a type of malnutrition. You can use the alphabetic index and then cross verify with the tabular listing. E00 to E07 is the disorders of the thyroid gland. So, the thyroid gland is present in the neck. When assigning codes for thyroid disorders, the coder should know the cause of the condition, whether it is acquired or congenital, and if or not it resulted from medical treatment. Also, it is important to note the presence of a goiter, a thyrotoxic storm, or a thyrotoxic crisis. So you can see the picture where the Graves disease symptoms are listed, like exophthalmos, bulging of the eyes. Then you have the goiter, that is bulging of the thyroid gland. You can see a big swelling in the neck. Then the patient may have arrhythmia and tachycardia, nausea and diarrhea also, oligomenorrhea. So the menstrual periods, they are not regular. Either they are very few or not present at all. Then muscle weakness is also there. So these are some of the symptoms, common symptoms of Graves disease. And E08 to E13 deals with diabetes mellitus. In ICD-10 CM, combination codes are often used for this category. When diabetes is related to an underlying condition, the coder should use the sequencing instructions provided in the tabular list. That is diabetes mellitus. So diabetes mellitus codes are combination codes that include the type of diabetes mellitus. So it can be type 1 diabetes mellitus or type 2 DM, secondary diabetes. So it includes, the code will include the type of diabetes, the body system affected, and the complications affecting that body system. As many codes within a particular category, ICD 10 CM official guidelines for coding and reporting are necessary to describe all of the complications of the disease. So you can use many codes. They should be sequenced based on the reason for that particular encounter. Assign as many codes from category E08 to E13 as needed to identify all the associated conditions that the patient has. This is an important guideline in this chapter. What will you do if the type of diabetes is not documented by the provider? Type of diabetes mellitus not documented. So if the type of diabetes mellitus is not documented in the medical record, the default is E11, type 2 diabetes mellitus. You assume it is type 2. If it is not documented, you assume it is E11. If it is documented, use that one. The reason is most of the patients will have type 2 diabetes mellitus, which is very common, whereas type 1 DM is rare. And also the age of a patient is not the sole determining factor, though most type 1 diabetics develop the condition before reaching puberty. So for this reason, type 1 diabetes mellitus is also referred to as juvenile diabetes. But most of the patients have type 2 DM, which is very common. So the diabetes mellitus codes are combination codes that include the type of diabetes mellitus, the body system affected, and the complications affecting the body system. And also you should code complications due to insulin pump malfunction, overdose or underdose of insulin due to insulin pump failure. So that should also be coded in the correct sequence. So diabetes may affect different body systems. See here in the picture you can see that CKD and hypertension are present along with diabetes. So all these are interrelated diseases. So then you have to take the combination code. Secondary diabetes mellitus and the use of insulin. So for diabetes mellitus, if the conservative measures like exercise, and also reducing the body fat, that is the body weight, all these measures are taken by the patient and still the blood sugar is not under control, then you have to go for the aggressive treatment measures like taking oral meds, anti-diabetic medicines, or even insulin. So here secondary diabetes mellitus and use of insulin. So how is the uh, codes sequenced? For patients who routinely use insulin, code Z79.4, but it should not be assigned if the insulin is given temporarily to bring the patient's blood sugar down during an encounter. So this is the key point. The insulin should be given to the patient permanently, that is for a very long period of time. The patient is placed on insulin and he has been taking it for months together, years together. So then you can use the code Z79.4. But if it is given just for 1 week, so that the blood sugar is normalized for some surgery or some other reason, it is only given temporarily, just for a few days or 1 or 2 weeks. So then you cannot use the code Z79.4. Post procedural hypoinsulinemia, like surgical removal of pancreas, assign the code E89.1. So once the pancreas are removed, surgically removed, the patient most likely will have hypoinsulinemia, because the pancreas is the main source of insulin production. So you have to use E89.1 if it is due to a surgery like surgical removal of pancreas. And sometimes secondary diabetes may be caused as an adverse effect of drugs poisoning or sequelae of poisoning. So this is the guideline related to secondary diabetes mellitus. So secondary diabetes mellitus codes under category E08 diabetes mellitus due to underlying condition, E09 drug or chemical induced diabetes mellitus, and E13 other specified diabetes mellitus. Identify the complications slash manifestations associated with the secondary diabetes mellitus. So what can cause diabetes? What are those conditions? So they are underlying conditions. So this picture gives you the list of the underlying conditions: cystic fibrosis, hemochromatosis, liver diseases, chronic pancreatitis, polycystic ovary syndrome, Cushing's syndrome, pancreatitis, pancreatectomy, pancreatic diseases, drugs and chemical induced, chronic renal failure, cystic fibrosis. So all these conditions are underlying conditions. So what you will be doing is code them first. The underlying condition should be coded first, followed by the type of diabetes mellitus. So secondary diabetes is always caused by another condition or event. So you should bear that point in mind. Secondary diabetes mellitus due to pancreatectomy, removal of the pancreas. One guideline in ICD 10 cm consistently overlooked is Section 1 Chapter 4 A6 BI, which is specific to secondary diabetes mellitus due to pancreatectomy. So what is that guideline? For post pancreatectomy diabetes mellitus due to lack of insulin due to the surgical removal of all or part of the pancreas, assign the code E89.1. Post procedural hypoinsulinemia, assign a code from category E13 and a code from subcategory Z90.41. Acquired absence of pancreas as additional codes. So whenever a body part is missing, check if it is congenital or acquired. So if it is acquired, then you have to add the code Z90.41. Also always remember Z codes will be placed in the second or third position only, not in the principal diagnosis position. Post pancreatectomy diabetes mellitus is classified along with a few other conditions into its own type of diabetes mellitus, commonly referred to as pancreatogenic or type 3C diabetes mellitus, T3CDM. So in this type of diabetes mellitus, the clinical indicators include both a lack of adequate insulin secretion and concomitant loss of glucagon secretion by alpha cells. In layman's terms, the body is neither making enough insulin nor is it making enough of the hormone needed to increase the glucose levels in the blood. These symptoms can make it difficult for the provider to determine if the patient has type 2DM, T2DM or T3CDM without further assessment of autoantibodies or ongoing insulin resistance. So this is particularly true in patients with pre-existing T2DM prior to surgery. So always follow the guidelines for each condition and sequence the codes accordingly. So E15 to E16 code ranges for other disorders of the glucose regulation, pancreatic, internal secretion. Conditions coded include non-diabetic drug-induced insulin coma, increased secretion of glucagon, and hypoglycemic coma, just to name a few. Disorders E20 to E35 code range will have the disorders of other endocrine glands. Conditions coded include hypoparathyroidism, hyperparathyroidism, Cushing's syndrome, thymus disorders, and puberty disorders. Diabetes mellitus due to underlying condition with diabetic nephropathy. The code is diabetes mellitus due to underlying condition is E08. Here there is an underlying condition. The condition is that underlying condition should be coded first. The underlying condition, for example, diabetes mellitus due to underlying condition with diabetic chronic kidney disease, which is causing the DM. So E02.22, use the additional code to identify stage of the chronic kidney disease N18.1 to N18.6. So you go to the code range N18 and select the stage of the CKD. So remember the underlying condition here, for example, it is CKD, so CKD that should come first, and then the type of diabetes mellitus. So diabetes mellitus due to an underlying condition with other diabetic kidney complication will be coded as E08.29. The underlying condition should be coded first as the principal diagnosis, followed by the type of DM. An update is what are the new codes in this chapter for the fiscal year 2022. One new code has been added, E75.244, Niemann-Pick disease type A or B. E75.244, new code for 2022. There is only one code which has been added. Coming to the treatment which is given for diabetes mellitus. So now you will be clear that this chapter focuses mostly on the guidelines for the diabetes mellitus. Though there are so many diseases which are covered under endocrine chapter, diabetes mellitus is the chief among them. So all the guidelines pertain to diabetes mellitus in this chapter. Coding the treatment for diabetes. The category is Z79. What are the different treatments which can be given for diabetes mellitus? Insulin can be used, which is injected always, or oral hypoglycemics. These are medications which are taken orally. Injectable non-insulin drugs. So you can inject certain drugs, but they are not insulin, they are non-insulin drugs, again to control the blood sugar. So be very careful and clear that you can inject insulin or non-insulin drugs also. So always check the document clearly, the type of treatment which is being given for the diabetes mellitus. If the documentation in a medical record does not indicate the type of diabetes but does indicate that the patient uses insulin. Code E11, that is the default code. Type 2 diabetes mellitus should be assigned. Additional code should be assigned from category Z79 to identify the long-term current use of insulin oral hypoglycemic drugs or injectable non-insulin anti-diabetic drugs as follows. So if the patient is treated with both oral medications and insulin, both codes Z79.4 long-term current use of insulin and code Z79.84 long-term current use of oral hypoglycemic drug should be assigned. So you should code both, because the patient is getting two treatments in the form of insulin and the oral medications. If the patient is treated with both insulin and an injectable non-insulin anti-diabetic drug, assign the code Z79.4 long-term current use of insulin and Z79.899 other long-term current drug therapy. If the patient is treated with both oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug, assign the code Z79.84 long-term current use of oral hypoglycemic drugs and Z79.899 other long-term current drug therapy. So always remember Code Z79.4 should not be assigned if the insulin is given only temporarily to bring a type 2 patient's blood sugar under control during an encounter. So this is an important guideline. So instead of injecting daily, you can wear a insulin pump which is fitted permanently, and it will be programmed. So it at regular periodic intervals the insulin will automatically enter the body through the insulin pump. So there is a continuous glucose sensor which will take the readings, and the readings are recorded. You can always check. There is an infusion set as you can see in the picture. So that will be injecting the insulin at regular intervals. So there is chances of failure of this insulin pump, so due to which there can be underdosing or overdosing. So complications from insulin pump malfunction. So check whether it is overdose of insulin or underdose of insulin. Then go to the category T85.6. This T85.6 category code is in the chapter 19. So chapter 19 contains all the complications. So here what is the complication? Insulin pump malfunction, that is the complication. So insulin pump failure, underdosing is coded using the codes T85.6 followed by the code T38.3 X6. That is a 7th character requirement for T38 category. So you have to assign the 7th character based on the encounter. Read it and then pick the 7th character. So T85.6 followed by T38. If it is overdose, which is also poisoning, that is coded using the codes T85.6 again, but the second code will be T38.3 X1. Again, that is a 7th character requirement for this. So you have to pick the 7th character requirement based on the encounter. So the first code will be T85.6 in both the cases. Underdose or overdose, you will be coding the first code as T85.6. So let us see some coding examples to understand better. A patient is morbidly obese with a BMI of 45 and has been struggling with weight control his entire life with little success. As a result of the obesity, he has also developed obstructive sleep apnea and pre-diabetes. He is admitted to the hospital for a laparoscopic sleeve gastrectomy. What is the diagnosis, coding and sequencing in this case? You can stop the video here and then you can check the codes and write it down and then verify if it is correct. So the key terms here are admitted to the hospital for laparoscopic sleeve gastrectomy. So you are going to be picking only the ICD codes. So morbidly obese, the BMI of 45, so this is the answer: E66.01, Z68.42, G47.33, R73.03. So hoping all of you got it correct. Another coding example is the patient presents to the ED severely dehydrated with nausea and vomiting. She has a history of type 1 diabetes mellitus, taking 15 units of NPH. The patient presents to the ED severely dehydrated with nausea and vomiting. She has a history of type 1 diabetes mellitus, taking 15 units of NPH and 10 units of regular insulin in the morning, and 10 units of NPH and 5 units of regular insulin in the evening. She has also experienced increased urination and polydipsia. The patient's blood sugar level exceeds 600 mg per deciliter. She is admitted to the intensive care unit ICU with diabetic ketoacidosis DKA and dehydration. Which is the coding and sequencing for this case? So how will you code and also sequence those codes? Do stop the video here, try to code this scenario, write it down and then continue. So diabetic ketoacidosis and dehydration. So E10.10 and E86.0. So the patient has type 1 diabetes mellitus. These are the codes and this is the sequence. So coding example again, the patient is a type 1 diabetic with diabetic chronic kidney disease stage 3 is being seen for regulation of insulin dosage. The patient has an abscessed right molar teeth, so which was determined in part to be responsible for the elevation of the patient's blood sugar. So what are the diagnosis codes which should be assigned? Do stop the video here, write down the correct codes and then check. So this is the sequence. E10.22 diabetes mellitus type 1 with CKD. That is a combination code because two diseases are covered in the single code. Next code will be N18.3, which is the CKD stage 3, K04.7 abscess teeth, which is the root. So this is the reason for the elevation in the blood sugar. So rationale is the tabular instructs the coder to use an additional code to identify the stage of the chronic kidney disease. So here it is N18.3. In this case, the hyperglycemia would not be coded since it was not documented by the physician as out of control in this limited documentation. So a physician query might be warranted. When you have a doubt with the documentation, always you can query the physician. Hope all of you got this answer correct. Let us see another coding example. Family members bring a girl age 16 to the ED after she collapsed. They state she has type 1 diabetes and has used an insulin pump for several years. She has been doing well until earlier in the day when she complained of feeling weak. Shortly after that, she collapsed. Evaluation in the ED shows the insulin pump had malfunctioned and was not dispensing enough insulin. She is admitted to the ICU for treatment of ketoacidotic coma caused by underdosing related to insulin pump failure. So what is the coding and sequencing for this case? Again, do stop the video, write down the correct code and then you can check the answer. So the first code will be T85.614A, initial encounter A. So this is a 7th character requirement. The second code will be T38.3X6A. Okay. So this is underdose of insulin. And the type of diabetes E10.11 should be recorded as the third code. So this is the sequencing you need to follow. T85, T38 and then the type of diabetes. So these are some of the important guidelines in this endocrine chapter with regards to diabetes mellitus. So hope all the guidelines and the rules for this chapter is clear. Thank you.